Welcome to this clinical demonstration on wound Activac setup and management, adapted to AHS guidelines. In this video, we'll walk through step-by-step instructions for applying negative pressure wound therapy safely and effectively. Receiving the wound VAC order. When a physician orders a wound VAC, first confirm the details. Type of foam, negative pressure setting, usually negative 125 millimeters of mercury. Mode, continuous or intermittent. Dressing change frequency. Special instructions, such as precautions for exposed bone or infection. Obtaining and setting up the VAC. Check if your unit has a VAC machine. If not, call Unit 23 and request a VAC unit. Bring 2 patient labels to pick it up. Record the serial number. Ensure all forms are filled and faxed to KCI. Make sure to label the VAC unit. Verify serial number. And review forms and fax to KCI. Document everything if the VAC is from the OR, ensure, or staff fax the paperwork. Activac unit and canister. The unit works by applying controlled negative pressure to the wound, which helps draw wound edges together, remove infectious materials and fluids, promote blood flow, and create a moist wound healing environment. A sterile fluid path container that collects and stores wound, exudate, fluid, and other materials from a wound site during negative pressure wound therapy. 3M VAC Granifoam Dressing Kit contains Granifoam dressing is a black, open cell polyurethane foam. It comes in various sizes and shapes, standard, small, large, or specialty cut. It promotes tissue granulation and wound healing. Drape is an adhesive, transparent film. Creates an airtight seal over the foam and wound bed. Helps maintain a closed, moist, healing environment. Sensatrack pad connects the dressing to the unit. Has suction tubing that transports fluid from the wound to the canister. Ruler to measure the wound bed and foam size. Cleaning supplies such as dressing kit, gloves, saline solution, and skin barrier wipes. Here's the Unit 21 specific materials you'll likely gather. Not mentioned in the previous slides is the following: Tegaderm film, adaptic non-adhesive dressing, and sterile scissors. Start with wound assessment and preparation. Perform hand hygiene, apply PPE, and explain the procedure to the patient. Start by irrigating the wound with saline and dry the wound bed and peri-wound area. Document the following: size and depth, tunneling or undermining, exudate and odor. Next, cover exposed bony structures with adaptic non-adhesive dressing, and then apply Cavalon wipe as both a protective barrier and to improve drape adhesion. Applying the 3M Granifoam dressing. Note: in the video it's not shown, but start by applying the Tegaderm film to the surrounding wound edge. Cut foam to the size of the wound bed, though Unit 21 typically uses black foam. Next, apply the transparent drape. Cut and apply the drape over the wound and surrounding skin, extending 3 to 5 centimeters beyond the wound edge. Make sure to put Tegaderm or extra drape, if not done yet, close to surrounding wound bed and then putting another drape on top. Next, cut a small opening in the drape about the size of an Oreo. Place the Sensatrack pad, the suction port, on top of the opening. Connect tubing to the canister and attach to the VAC unit. Note: in this demonstration, the canister is pre-filled with simulated exudate using watermelon juice. For clinical use, always ensure a sterile, unused canister is attached prior to patient application. Next, set the ordered pressure and more. Confirm that the foam is firm, flat, or slightly concave, indicating negative pressure is working. Now let's discuss managing potential complications you may encounter, such as skin breakdown from drape. Use a skin barrier wipe, trim the foam properly, and prevent fluid pooling. Skin maceration. Apply a skin barrier, trim foam to fit the wound, and avoid pooling of exudate. Bleeding, especially in vascular areas. Apply gentle pressure, stop suction immediately, and notify the provider without delay. Continuation. Infection. Document findings, take a swab if ordered, notify the provider, and reassess the frequency of dressing changes. Pain or discomfort. If ordered, pre-medicate with analgesics before dressing changes and monitor for increasing discomfort. Seal loss or equipment malfunction. Use ostomy paste, Tegaderm, bridging techniques, or additional drape to reinforce the seal. Next, check machine alarms and confirm suction is continuous. If complications persist, consult wound care nurse or unit clinical educator. Here are the Activac troubleshooting tips. For seal check, apply extra drape or Tegaderm or skin barrier film to smooth, uneven surfaces. Repressurize after fixing the leak for low battery. Plug into power source immediately and allow the machine to charge completely. For leak alarm, reinforce drape, double-check suction port seal, contact wound care nurse or clinical educator if unable to resolve after multiple attempts. For low pressure, reapply tubing connections, reset pressure settings as ordered, replace canister if full or if suction isn't holding. Again, if complications persist, consult wound care nurse or unit clinical educator. Now document all procedure details in either avatar or flow sheets. Date and time, type of foam used, pressure settings and mode, dressing change frequency, patient tolerance. Ensure that all VAC forms are placed in a scanning tray at the front desk, scanning these into patient charts. They will be scanning if under equipment, device information, as per Curtis. This can be found under Unit Manager screen, which provides more option when scanning into charts. Now, if the VAC is discontinued, follow the steps below. Turn machine off for 30 minutes. Remove and dispose foam and canister contents. Document the following serial numbers of VAC to the VAC case, paperwork in the case, on the patient chart. Notify discontinuation of VAC via phone call. You will likely have to leave a message. Leave the serial number, unit phone number, and patient initials. Complete and fax discontinuation of VAC section paperwork. Include cover letter for fax, confirmation sheet number, KCI form with name of the representative. Make 3 copies of the paperwork and place 1 copy on patient chart, KCI binder, and VAC case. Now, if transferring a patient with an Activac, call KCI to notify or transfer a VAC. Make sure the Activac is not from Unit 21 or Unit 23. If so, change it to a rental KCI before the transfer. Always call KCI to change the billing to wherever the patient is transferred with a VAC. Fax transfer of VAC paperwork, ICN looting, confirmation number, and name of representative. Obtain 3 copies of paperwork and fax confirmation. Place 1 copy on patient chart, VAC case, and KCI binder I. For home discharge, physician order is required. Ensure home care referral is made if needed. Provide spare supplies if requested by home care. AHS. Home care coordinates equipment through AHS contracted DME providers. Educate the patient with signs of complications, machine care, and troubleshooting. Provide emergency contact info for home care RN. Wound vac therapy supports faster healing and better outcomes when done safely. Follow AHS protocol and communicate with your care team. We hope that this step-by-step guideline will help you succeed and be confident in using wound Activac therapy. For more information, get in touch with the clinical educator or refer to KCI Binder and AHS guidelines for more information. Thank you for watching and have an awesome day.